Today, we're talking about the multivitamin, calcium, mineral, and soy isoflavone tablet. This medication is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. It is important to take this medication as directed by your doctor. The daily dosage and optimal timing for taking this medication will depend on your individual needs and health condition. Always consult with your healthcare provider for the best time to take this medication and the proper dosage for you. When taking Multivit, Ca, Min-Fa-Soy Isofl tablet, it's important to follow the dosage instructions provided on the product package or as directed by your doctor. It's generally taken by mouth once a day. It's crucial not to exceed the recommended dosage. If you have any questions or concerns, it's best to consult your doctor or pharmacist. For optimal benefits, it's important to take this medication regularly at the same time each day. This will help you get the most benefit from it. Be sure to establish a routine for taking this medication to help you remember. If you experience constipation, diarrhea, or an upset stomach while taking Multivit, Ca, Min-Fa-Soy Isofl tablet, these effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. One important thing to keep in mind when taking Multivit, Ca, Min-Fa-Soy Isofl tablet is to ensure that it is stored out of reach of children, especially if it contains iron. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it is crucial to seek medical help immediately or contact a poison control center. As always, it's important to be mindful of the safety of those around you when taking any medication. Before taking Multivit, Ca, Min-Fa-Soy Isofl tablet, it's important to talk to your doctor or pharmacist about any allergies you may have, including soy or peanuts. This product may also contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin contains folic acid, be sure to inform your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's important to consult your doctor or pharmacist for more details on this matter. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's crucial to discuss the use of this medication with your doctor. It's important to be aware of any potential interactions with other medications you may be taking. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Be sure to talk to your doctor or pharmacist about how to properly space out your doses and find a dosing schedule that works with all your medications. If your multivitamin also contains folic acid, it's important to inform your doctor or pharmacist if you are taking certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to let your lab personnel and doctors know that you are taking it. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 for emergency assistance or contact your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to keep all medical and lab appointments to ensure you are getting the most out of this medication. Some brands may also contain additional ingredients, so it's best to consult with your doctor or pharmacist if you have any questions about the specific ingredients in your brand. Remember, this product is not a substitute for a proper diet. It's always best to get your vitamins from healthy foods. It's important to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor to maximize the benefits of this medication. If you forget to take this product at the scheduled time, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at the regular time. Do not take a double dose to make up for the missed one. Make sure to store Multivit, Ca, Min-Fa-Soy Isofl tablet at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. Also, never flush these tablets down the toilet or pour them into a drain unless specifically instructed. When the product has expired or is no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.